Well, hello everybody, and welcome to this summer school. I'm very proud and pleased that this event has started, and I just wanted to say a very, very warm welcome to you all, regardless of where you're tuning in from and what your role is. You are all very, very welcome. My name is Paul Edwards. I'm Director of Clinical Services at Dementia UK. I've been at Dementia UK for nearly 3.5 years now. And my job really is to help grow the number of Admiral Nursing services we have. It's to try and make sense of our impact through our insights and evaluations of those services. It's also to try and influence policies and the government and the politics of dementia, really, by articulating the needs of people with dementia and their families, and what we do as specialist nurses that makes a difference to the way that we care for people, in the hope that that translates into more nurses on the ground, more services for people with dementia and their families, and a recognition that dementia nursing, and particularly specialist dementia nursing, really matters and really makes a difference. I'm a nurse, and I've worked in dementia care in various different areas, in academia, in social care, in the NHS, and now in this sector for the last 27 years since I qualified. And I think the interesting thing for me is that we are never more needed as dementia nurses, and we have been through and still going through really a really tough time, and we know that people with dementia and their families have been the hardest hit through this pandemic. And I pay tribute to all of us, all of my teams, and all of you out there that have been working so hard to provide the care that we think that people with dementia and their families need. When I think about when I trained as a nurse, and I told people when I qualified that I was going to go into dementia care, I was told that I would probably lose my skills really quickly, that it was a bit of a backwater, there's not a lot you can do, it's an area of where they put the bad people or the naughty people or the people that made a drug error. That was the case 27 years ago. It was complete nonsense then. It's complete nonsense now, because my fundamental belief is that whether you're a person with dementia or you're a family trying to support a person with dementia, you have a right to the best clinical nursing support and advice, regardless. And that has always been the case. It isn't just, in the last 10 years where dementia's starting to take a foothold and we're starting to understand more about the needs and the skill sets required to support people with dementia. It has always been the case, because I think it is a right for people to have access to the right help and support, the right clinical advice, and access to nursing when they need it. And that has always been the case. And I think slowly, very gradually, the case for and the recognition of what nursing can do for people with dementia is slowly starting to be understood. And of course, nurses in dementia care work with a range of colleagues right across health and social care, and it's uniting that effort that's going to really make a difference to people with dementia and their families. And that's what Admiral nurses are really good at, actually connecting up the dots and the gaps to wrap around care around people with dementia and their families. And it's not easy. When I think of the state of dementia care in this country, there are so many gaps. There are errors right from pre-diagnosis right through to end of life. We have people with dementia and their families dropping into all of these gaps of service, of understanding, of a society that still doesn't care enough about the things that we all care about, which is a better, higher quality of life for people with dementia and their families. And I hope over the next few sessions in this summer school, you get to be exposed to some of the ideas. You get to listen to the specialist Admiral nurses and their take on things, and their experience and their evidence that they draw on to provide the care that they give. And it's joyous in my position, because I get feedback about the care and support from families and people with dementia of of our Admiral Nursing services, and it's probably one of the best jobs ever for getting feedback that is transforming people's lives, and I believe that's what we're about. Nursing has, and always has been, a power for social good and a power for social change, and that is never more needed in dementia care than now. And let me talk to you a little bit more about why I say that. We've been through and still going through months of a pandemic which has really affected people with dementia and their carers. It has changed the way that people with dementia and their families have been able to access services. It has reduced the amount of support for people who live in their own homes. It has challenged to the core the way that we provide family support within our care homes and all of the visiting, which some of you will know very well. That's been a real difficulty. And I think that's why we need to change. And I think that's why we need to build a much broader professional approach to how we understand the experience of living with dementia and caring for dementia. And that's what some of the ideas that you hear across the summer school, some of those will be based on those ideas of, you know, what's not working, how can we make it work, what are the best approaches to tackle this particular issue. Those are the kind of things that we're going to get involved with, and it's because the pandemic, if you like, has just exposed that fault line in society that we knew was already there, that care and support for people with dementia could be so much better if it was invested in, if we cared enough about it as a society to make a difference, if those who support people with dementia professionally are allied health professionals, are social care professionals, and I refuse to call them care workers, they are social care professionals, our support for our home managers, our nursing profession, if all of those had the knowledge, the help, the support, then what a difference that would make to people with dementia and their families. And I know that from my own family experience, but I hear it all of the time. I hear people who contact our helpline that are in a desperate state because of this lack of provision and this lack of service. And I suppose I question why we have got to this place, because I know it's not been right for a long time. You probably know it's not felt right. You probably felt like you haven't been exposed to enough knowledge during your training. You know these things, and I know these things. So how have we got here? What is it that we have done as a society that has impeded us getting to a better quality of life and a better quality of care for people with dementia? And that's what I'm really interested in, because I think if we can understand that, then we as a collective, wherever your background is and however you've ended up at this summer school, we as a collective can work to make a difference. We can support each other, we can share knowledge, we can, engage on different ideas about best practice to make the difference that families need. And that's really what I'm all about. I think for me, we still live in a society that is fundamentally ageist. Imagine if everybody diagnosed with dementia was aged between, 10 and 30, would we have a different societal response to the one we've got now? And I can't get away from the fact that, yes, we probably would. So why is that? Why have we got such a skewed attitude towards dementia in society? Is it just ageism? Well, that's part of it, for sure. We still have these ageist values and views coming through when we think about dementia. But of course, that doesn't cut everything, because, we know that there are tens of thousands of people with dementia diagnosed very early on, so much younger than 65. So it can't just be the ageist issue that is holding us back. It must be something else. And I think what we face as nurses and what you face, regardless of your role, is an unwillingness to recognise the impact that dementia has in our society. It's like a dementiaism, for want of a better phrase, and that's what we are tackling. Not just in our clinical interventions. We are fighting against a society that has inbuilt, sometimes unwittingly, has inbuilt dementiaism. So every barrier we face is not just a barrier about funding and issues and or a lack of integration and all those other stuff that are very common. What we're facing, actually, if you really think about it, is a societal response to dementia that isn't good enough and has these really deep set views on what it is like to experience dementia and live with dementia. But we know different, right? We know that when we work with people with dementia and their families, when we intervene at the right time with the right evidence bases, it makes a difference. It makes a difference to that person, it makes a difference to us personally, and it can relieve a lot of the tension and a lot of the stress and a lot of the complexity that goes on when you're working with people with dementia and their families. And every one of those people we work with that gets helped, actually we're doing something very significant. We're saying to that person and that family, you actually matter, you have dementia, and we are going to try and make it the best experience as we possibly can. We're going to try and do things that make a difference to your lives on the ground. They may be very practical things, they might be quite therapeutic, they may be just holding and supportive things, but they make a difference. And that's because we have a set of values that says that people with dementia in our society matter and how we care for them matters. Which kind of brings us back to today, right? And this summer school, that's what we're here for. We're here because we're compassionate and we care desperately about trying to help people with dementia and their families get through some of the most difficult times of their life. So when you join in the sessions and engage with those across however many you're attending and across the next few days, remember that you're here because you care very much about the experience of people with dementia and their families, and you want to make a difference, and you want to learn, and you want to engage with, you know, specialist Admiral nurses and all sorts of other people because you are genuinely interested in making a difference. I was genuinely interested in making a difference 27 years ago. I'm still in this sector and I still feel like I am genuinely interested in making a difference. And for me, that's the most important thing, because people with dementia and their families sometimes need us to help them. Sometimes need us for this to take away the pain, some of the difficulties they face. And nurses are good at that, right? And we are great at that in other areas, right from midwifery through learning disability, through mental health, through acute care, whatever it is. We are really good at easing the pain that people are experiencing and helping them cope with their lives in the best way they can. So I hope that's been a reasonable introduction. We'll be doing some Q&As. I'll be around for those. You are very, very welcome to drop some questions in around the Q&As. I may not have all of the answers, I'm aware of that, but we are surrounded by lots of people who care very much about people with dementia and their families, including you. And you have such a valuable contribution to make to this field. So thank you for joining us. Please feel free to give us any feedback. It's the first time we've run a summer school like this, so we are really open to learning about what's working for you, what could be better, what could be different. That's what good nurses do. They reflect on what they do and then try and adapt and make improvements day by day, year by year. And the other thing, just before I go, is I hope you really enjoy it. I hope you have some fun. I hope you get to see that there is a community that cares about things just as much as you do. And whether you're a student nurse thinking about your next career or your first career job, or you're a nurse at the moment that is thinking about whether dementia care might be of an interest to step into if you're not currently in that space, then I hope that this event just gives you a little bit of inspiration, a little bit of a connection with an organisation and a group of nurses who care passionately about the experience of people with dementia in our society. So have a great time. Let us know your feedback, and take good care of yourselves.